as Florida numbers rose this week and the positivity rate remained in the red zone. South Florida's Democratic members of Congress implored Governor DeSantis to issue a statewide mask order as well as more targeted stay-at-home orders.
And one of the congressmen signing that letter is Representative Ted Deutch, a Democrat from Boca Raton, represents the 22nd Congressional District, Northern Broward, Southern Palm Beach counties. He's joining us. We see him there by Skype. Congressman, good morning. Great to have you on the show.
Well, it's great to be with you both. And Michael, I'm glad that you're back and doing better.
Well, thank you so much. I'm fully recovering. Congressman, you and the other Democratic members of Congress from South Florida, really blasted the governor for his handling of the coronavirus crisis, COVID-19. What is your principal criticism?
Well, the principal criticism is that we continue to see the number of cases increase dramatically, the number of hospitalizations increase dramatically, and the number of deaths increase dramatically week after week. And yet the governor continues to try to change the subject, to downplay the severity, to make us think that what we're seeing every day is actually different than what it is. Yesterday, when the governor suggested in the most offensive way to the people of Florida that we can't tell the difference between the number of cases and the number of people being hospitalized, and perhaps we're getting them confused. It's the governor's confusion. It's his failure to lead, to put in place the kinds of steps that are necessary right now that can help bring down the number of cases and bring down the hospitalizations, give our frontline workers a chance at this thing, and to save lives. That's all we want to do. That's all anyone wants to do, is to let the public health experts tell us how we can work together to save the lives of Floridians.
All right, so Congressman, you and a lot of other people are asking the governor for a statewide stay-at-home order. From the beginning, the governor has said that he's leaving that to the locals because, in fairness, this pandemic looks very different in South Florida than it does in different parts of more rural Florida. And in fact, our local leaders have instituted mask orders and closures that we're out every day and we see people violating even with them in place. So how do you envision a statewide mask order being enforced when people are obviously not following them, those that are already in place?
Right. Well, I'm reminded of the quote I saw from Mayor Suarez, who had it just right, that people follow the people who are, I think he said, who are supposed to be leaders. And that's what we need from the governor. I understand that it's a big state. I understand that there are different challenges in different parts. And we've urged the governor to work with the public health officials to tailor the response in the different parts of the state. But right now, when everyone from the public health experts, the doctors, the hospitals, the CDC, everyone tells us, even the administration now acknowledges that wearing masks is the best thing that we can do to help prevent another big shutdown, to help save lives and to help give these doctors and nurses a chance. When that's the one thing that we know will work, then let's do it. I really don't understand why it's so hard to simply require that people do something that can help save lives. Yeah. Because without using that same kind of logic, we wouldn't have seatbelt laws, because different parts of the state are different. People ride differently. We wouldn't have a whole host of laws that are in place to keep us safe. Masks can help stop the spread. If we stop the spread, we're in a better position to save lives and to help us get through this.
Yeah. Congressman, what about the cause and effect thing here? We have President Trump, who says, yeah, all right, masks are all right under certain circumstances, but he really doesn't wear one, wore one once at Walter Reed Medical Center. And of course, Governor DeSantis is his disciple. Trump is his mentor. The president doesn't really like to wear a mask. The governor will, on occasion, wear one, but he says one size doesn't fit all when it comes to wearing a mask in Florida. What do you think?
I can't believe that quite frankly, I can't believe that we're having a debate about wearing masks. That's what I think. I can't believe that when hospitals are filling up they're putting beds into conference rooms because they're out of space otherwise, that when hundreds of people are dying in our state, that we're having a discussion about whether the president thinks it's okay to wear a mask, and since the governor is his disciple, maybe he should follow along. Michael, I don't care about any of that. And the governor shouldn't either. Everyone who's watching your program knows that the governor's top priority should be keeping the people of this state safe. He doesn't work for the president. He works for the people of Florida. That's where he should be focused. And that focus should tell him that we ought to be doing everything we damn well can to help stop this thing from getting worse and to help save the lives of our friends and our neighbors and our relatives, because too many of us have seen people close to us get sick. We've seen it just this past week.
Yeah. Congressman, let me follow up here. To give the governor his due, he and his staff took great care looking at long-term care facilities, ALFs, nursing homes. They sent in crews to, National Guard people to go in and test the staff and the residents there. And as bad as it has been, the death toll among elderly people in the state, the governor says it might have been worse, and I suspect he's right.
Michael, there'll be plenty of time for us to go back and do a full assessment. I have given the governor credit where it's due as we've gone through this, even if it sometimes took too long for him to get to the place that he needed to be. But this isn't about politics. I don't want to have a conversation about what could have been worse in nursing homes any more than I want to have the conversation about all of the things that the president of the United States and then governor could have done to save thousands of lives. There'll be plenty of time for that. Right now, I want to make sure that this whole process isn't being driven by me and by the governor and by the president, that it's being driven by the public health experts. And when you talk to the doctors and you talk to the hospitals and you talk to the epidemiologists, they will tell you it's time to stop looking for credit or blame, and it's time to take action to save lives. That's got to be the priority.
Congressman, I want to go back to something you just referenced that you also talked about when you were on a Zoom press conference on Friday with some of your colleagues in the House. You talked about how you have been talking to some doctors, people on the front lines, some nurses, and you've been hearing really concerning things about the lack of protective equipment. You mentioned some hospitals are putting beds in the garage because of this capacity. And I will tell you, we heard something that I took to be far different from the CEO of our public hospital in Miami-Dade. Carlos Magoya this week, while sounding the alarm, did say that they are managing the census, that they have plenty of PPE. Staffing, he said, was their issue. So this seems to be sort of a more serious in more spots than others.
Right. That's absolutely true. And staffing is a problem. I'm glad he acknowledged it, that staffing is a problem in Broward. We've heard the same things. And when you have short staff and you need to bring in nurses and respiratory therapists from other places, you have to train them. That takes time. It costs money. You also, as the number of cases increases, you put more nurses at risk of getting sick. And when they have to then quarantine, you have to bring in even more people. So instead of constantly focusing on whether right now we have a sufficient number of hospital beds where we're making do, that's the message. Every hospital will tell you they're making do because they have to. That's their job, and I give them incredible credit for being able to do what they're doing with their doctors and nurses and everyone else who works there. But we ought to be working together to help them. We help them by wearing masks to stop the spread. We help them by having a sound policy that goes out and cracks down on places that are violating the rules. We help them when we're looking for all of the ways that we can stop the spread. That's what we ought to be doing together. That's going to ultimately help the hospitals. I don't want to get to the point where the hospitals are saying we are completely out of ICU beds, we are completely out of beds. I don't want it to look like the scenes from Italy with patients in the hallways, and I don't want it to look like New York. But I don't want to wait until that happens. I think we need to take action now. That's what we want from the governor, and he ought to be able to do it. And he ought to bring the public health officials front and put them in front to lead this discussion, because all of the public health officials I talk to tell us that the time has come to take drastic action to get this thing under control.
Yeah. Congressman, hold your thoughts. Stay right there. We will be back with more with Representative Ted Deutch in just a minute. We are glad you are with us on this Sunday on This Week in South Florida. We are speaking with Congressman Ted Deutch, Democrat from Boca Raton. Congressman, you've probably seen the front page of the New York Times. The lead story today is how the White House in mid-April, with the president's direction, decided to shift responsibility for fighting COVID-19 from the federal government to the states. And at the same time, they assumed that it was going down. Of course, it was not going down. It began to ramp up. And today, I think we're seeing the effects, the results of that in a poll. The Washington Post ABC News poll shows that Vice President Biden is at 55%, President Trump is at 40%, and in Florida, Biden is up by 6 points. So the decision, first of all, to leave it up to the states, kind of a behavioral sink, everybody, social Darwinism, every state up for themselves, that was not a decision that in the end the people of America, people of Florida wanted.
No, this was the single greatest opportunity, frankly. Yeah, you hate to think about it in these terms, but this was an opportunity for the president to display true leadership. The crisis that the country faced was so severe, it cried out for national leadership, and the president failed. There's no other way to look at it. That article this morning was stunning. The way that the president attempted to shift blame to try to create an opportunity for him to defend himself against any charges that would come, even as we now face these dramatic increases in cases and in hospitalizations and in deaths. But Michael, you don't need to go back to April. You only have to look at where we've been for the past month, where the House of Representatives passed legislation to help struggling Americans, especially here in Florida, where you still have over 1 million Floridians out of work, who are going to see the end of their unemployment benefits if the Senate doesn't act. We extended those benefits. We extended the additional federal supplement. We provided additional payments to help people who are really struggling. And there's been silence from the Senate. And the president, once again, as has been the case throughout this entire pandemic, has failed to step up on behalf of the American people. He's failed to help address the health crisis. And right now, by refusing to go forward with the HEROES Act, he's failing again to address the economic crisis. That's a really dangerous 1-2 punch. It's too much for the American people to endure.
Congressman, I'm sure you're hearing from your constituents who are expecting, needing, increasingly desperate for unemployment relief. The Department of Economic Opportunity statewide puts out daily their status as of Saturday. That office said it paid out almost $11 billion in claims to 1.7 million claimants in the state, and yet we hear that, I know you hear, from people still trying to get money and finding roadblocks on the site. What can you tell us about that?
Well, I can tell you that there is nothing more painful than to have conversations, which we have literally every day. It's still from people who call and tell us they've never been in a crisis like this. They've always been able to support themselves and their family. They've always been able to pay their bills, but because of this pandemic and the economic damage that it's wrought, they're out of money. They can't get by anymore. They're out of food. The stories are so painful. And yet here we are still struggling with an unemployment system that's been a total failure. It's not a question of how much money that was paid out. It's all of the people who spent hours and hours and days on the phone waiting for help, calling our office, calling their other elected officials, begging for a system that could actually respond to their needs, and it couldn't. And and we saw excuse after excuse coming from the governor, ultimately blaming unemployed Floridians themselves for not knowing how to fill out forms. I wish that he would take some of the calls that we get and understand how dire this economic situation is. And now we're just a week away from it getting even worse when the federal benefits stop. Where is Marco Rubio and where is Rick Scott right now when Floridians who are desperate, are about to see things get dramatically worse if the Senate doesn't act, and they're playing politics with this? I don't understand it. It's not fair, and it certainly isn't right.
Yeah. Congressman, let me ask you a couple of quick political questions. As you well know, August 17th, the Democratic National Convention, the new slimmed down virtual convention, is going to take place in Milwaukee. Maybe they say 500 people will be there. You're certainly, one of the people who could attend. Are you going to actually go to Milwaukee?
Well, I think right now the plan from the last conversation I had with the party officials was to put on a big souped-up online convention that will be accessible to everyone in America, that will give everyone the opportunity to hear the vision that Joe Biden has to lead our country back to a place of prominence in the world, and an administration that will once again show respect and kindness and empathy and be willing to work every day on behalf of the American people instead of solely on behalf of the president. I think everyone's going to get to see that. You're right, it's not going to be in person, and I don't think that I'm going to be there in person either, but certainly look forward to playing whatever role I can in this big online effort that's going to be broadcast as well. People will see clearly the vision that Joe Biden has for America, and I think they'll especially come to understand how different the visions are between the one I just described and one that is focused solely on President Trump's protecting himself, protecting his family, looking out for ways to avoid blame instead of looking out for ways to help the American people.
Congressman, I know that you have become an online expert, really enjoying your Facebook posts every single weeknight. So thanks so much for being with us. Good to see you.
Thanks, Congressman.
My pleasure. Thanks so much. You do. It's good to be with you.